All right, everyone. Good morning. Thank you so much for joining Advocates for Ohio's Future for our American Rescue Plan Act review on this beautiful Friday. I am very, very excited to have a great number of my leaders within Advocates for Ohio's Future joining me today to share their expertise and their takes on the American Rescue Plan Act along the different issues that they study all the time and are excited to kind of share what they've learned with you. And just in general, really excited about all these resources heading to Ohio. We want to make sure that they are used as effectively for families as possible. And again, really used to not only continue to allow our state and families to recover from the pandemic, but to also invest in the future and make sure that we come back stronger than ever. So there is not a minute to waste today. We have lots of great things in store for you. So I will go ahead and pass it over to Tara Britton. She is a co-chair within Advocates for Ohio's Future, and she's also the Center for Community Solutions. So Tara, please take it away.
Thank you, Kelsey. Thanks to everyone for joining today. I think you will be full of information at the end of this webinar today, but I know all of my fellow AOF steering committee members have been teaching me a lot about all of their issue areas of expertise, and we're really excited to be able to bring this opportunity to you all today. Advocates for Ohio's Future, of which I am proud to be co-chair, is focused on promoting health and economic well-being to really improve the lives of all Ohioans. We want Ohioans to all live better lives through improving health and human services. We work a lot with the legislature and the executive branch of state government to move those health and human service policy solutions forward. As it relates to the American Rescue Plan Act, this is a historic investment. We've been dealing with a global pandemic for the last year, over a year. We're still in it. Obviously, some things are changing, some guidance is changing, and that will also impact public policy. So, continue to follow Advocates for Ohio's Future for updates on everything there. But this is a historic investment to really rebuild in a more fair and equitable way. We think this is really important to understand. These are one-time dollars. We want to promote using them in a way that is, makes good investments, can be sustainable into the future. So making investments that will really move us forward. We want there to be a transparent process in how these dollars are allocated. So knowing that some are going at the state level, at the local level. There will be, I think, vast opportunities for other entities, nonprofits, and local governments to apply for different sources of money. As more and more guidance rolls out, we'll be trying to keep up to date with that as much as we can. And we want to make sure that these dollars are allocated in a way that is directed at folks who were most impacted by the pandemic. So we know that people of color, people who were working in lower wage hourly positions were disproportionately impacted through the pandemic. And we really would be doing an enormous disservice if we weren't looking at who was most impacted during the pandemic as we allocate these dollars going forward. So with that, just a few logistics. We will be recording this webinar. The slides and the recordings will be available online as soon as possible. I know sometimes it takes a little bit to process all of that, but we certainly will be sharing those and make those available to everyone. Also, if you have questions throughout, please submit those in the Q&A section or the chat. Those will both be monitored by folks who are keeping an eye on all of those things. I know there's a lot of smart people on this call who will hopefully be able to get to all of your questions, but if not, we will be able to follow up afterward. With that, I will turn it over to our first speaker. Thanks, Kelsey.
Thank you, Tara and Kelsey and everyone on the line. I'm grateful for this opportunity to speak with you today. I'm going to cover the American Rescue Plan Act's Coronavirus State Fiscal Recovery Fund in the aid to Ohio. Next slide, please. I'm Wendy Patton. I'm a senior project director with Policy Matters Ohio. We're a nonprofit policy research institute that builds a more vibrant, equitable, sustainable, and inclusive Ohio. Follow us on Twitter, like us on Facebook, sign up for our e-news. Next slide, please. Okay, the Coronavirus State Fiscal Recovery Fund. This is the money that's coming to the state of Ohio to use in the rescue in ways that Ohio uniquely needs. The state will receive 5.37, about $5.4 billion, and it will be used. The first tranche of money will come this year, this month, maybe this week. So about half of it comes in now, and the other half will come in a year from now. The funds are to be fully obligated by December 31st of 2024, but because there are allowed and eligible uses for infrastructure that takes time, and the long period of time addresses the fact that we are uncertain of what the needs will be in the out years. So the monies have to be obligated by December 31st, 2024, but fully expended by December 31st, 2026. Reporting continues throughout that time period. The rules governing the Coronavirus State Fiscal Recovery Fund were published on Monday, the interim final rules. You can Google them. They are very stringent, they are targeted, and there is also stringent reporting requirements and a recovery plan reports on outcomes. State and large cities must have public-facing websites. Transparency and public input are hallmarks of this plan. Next slide, please. The state funds can be used there are four big buckets. And again, this is a rescue act. It is for rescue and recovery. We've got the American Jobs Act coming down the road. We have the American Families Act coming down. This act is for recovery. It will pay for measures that quell the pandemic and prevent outbreaks. And that can be things that range from research on long COVID, tracing and testing and mitigation through physical plant improvements to public hospitals, health centers, addressing mental health needs, and dealing with the disproportionate health impact on racial and ethnic minorities, people of low income and vulnerable communities. There's a great deal of emphasis on disparate health and economic impacts throughout this plan. The Coronavirus State Fiscal Recovery Funds can be used to provide premium pay to essential employees or grants to their employers to provide to them to help repay essential workers like home health care workers, child care workers, retail distribution, and food workers who kept putting themselves at risk while others of us were able to shelter at home. There are a number of states, I believe there's maybe 5 or 6 different states that have set up grant programs directly for employees, ranging from grants of $250 to $2,500. This is the kind of activity that is envisioned by under the state recovery fund. These funds can be used to rebuild and to build better our investment in water, sewer, and broadband infrastructure. The water and sewer is encouraged, eligible projects are encouraged to align with rules under the Clean Water and Drinking Water Acts of the federal EPA. We'll hear more about broadband. This is not for roads, streets, bridges, and potholes. This is to address ways of keeping us health and building us up from what has been a very difficult pandemic year. The broadband addresses economic and educational opportunities. It is to be used to restore public services. While Ohio's revenues seem to be coming in okay, many states are not okay. There have been over 1 million public employees laid off across the nation. Employment in the local educational sectors is down by nearly 9%. So these funds are to be used to restore governmental services. Next slide, please. Next slide. Yes, here we go. Okay, so some ways that Ohio lawmakers could use the American Rescue Plan Act funds. We believe that everything, all of the 34 recommendations of the Minority Strike Force Blueprint fit in under eligible uses for this state rescue money. They address the needs of disparities in health and economic circumstances. They are the plan itself specifically targets what is called qualified census tracts. These are census tracts in which half of the population has income of no more than 60% of the area median income, or 25% are in poverty. So the recommendations of the Minority Health Strike Force often address those kinds of disparities and would fit in for housing, from childcare to educational and job opportunities. The Ohio's lawmakers could fund Ohio's local public health system so it responds better in the next pandemic. The governor himself called out the fragmented and uneven level of public health across the state as contributing to difficulty in coordination of response. Ohio's local public health is $93 million short of the capacity and capability that it needs. It could start to be rebuilt with these funds. It could reduce the lead poisoning of children, and in the interim rules, replacement of lead service lines is specifically identified as an appropriate use. And we understand that a coalition is out there advocating for $1 billion of this money to be spent in that way. It can be used to ensure access to good, affordable broadband and many other uses that you'll hear about today. Next slide, please. And then I'll wrap it up. People have to get involved. The American Rescue Plan state dollars require public input and coordination. It requires shovel-ready programs, and we encourage all to get involved. And final slide, please. Yeah, thank you for this opportunity. One last point I want to make is there are certain uses that are forbidden. Tax cuts that take your revenues below your 2019 levels are forbidden. Debt service and issuance costs for bonds is forbidden. Use of these funds for state share of Medicaid is forbidden. Pension funds are forbidden. So there are some forbidden uses, but there are lots of good uses that this can be used for. Thank you.
All right, Wendy, thank you so much. We are going to quickly transition to our next presenter, Graham Bowman from the Ohio Poverty Law Center. Are you able to bring his slides up?
Yep. Kelsey, I'm sharing my own screen, right?
Yes, sir.
Okay. Okay, so thanks everybody. My name is Graham Bowman. I'm with the Ohio Poverty Law Center. We are the policy arm of the legal aids throughout the state that provide free legal, civil legal services to low-income Ohioans in every county. So my presentation, I'm going to be talking about the local government fund, and I'm going to kind of do a 30,000-foot view look at the various pots of money that are available. This is really sort of an extension on what Wendy just presented on at the state level, because it's the same allowable uses for local governments. And I would say that I'm very excited for this presentation because in preparing for it, it just dawned on me how many resources are available. So if you remember nothing from this presentation, just remember that there is really an unfathomable amount of resources available. There are a wide range of uses. Wendy went over some of those. And there are multiple different pots of money. So that's what I'm going to start talking about, is what the different pots of money are, because I'm already in the media seeing some sort of confusion and conflating of what the different pots are. So with a piece of legislation this large, it's important to stay kind of oriented. So this is, and these slides are really, I'm going to make these available to anybody that wants them. There's a lot of hyperlinks in here for people to see guidance and more specifics that I don't have time to get into today. So the Treasury puts all of these pots of money under their banner of assistance to state, local, and tribal governments. So the State and Local Fiscal Recovery Fund, that is the fund that Wendy just presented on the state level, but it's the same pot of money that is providing assistance to other local governments. I'm going to get into those as well. The rest of the programs on this list I'm not going to talk about, and some of them are going to come up later on in the webinar, but it's just important to remember that they're there. For example, the Capital Projects Fund, that's $10 billion. We don't have guidance on that yet. We don't know how much money Ohio could get from it, but a lot of these sort of infrastructure projects might also be able to be funded through that as well. All told, if you look at the amount of money that Ohio is getting from all of these different sources, it's upwards of $16 billion. So it's a extremely large amount of money that can be used for a wide variety of purposes. So moving on, in that State and Local Fiscal Recovery Fund, of that $350 total billion, it is broken up nationally the way you see here. So the states get 195 billion, but then county governments are going to get 65 billion, metropolitan cities 45, tribal governments 20, territories 4.5. Then non-entitlement units of local government, I'm going to spend some time at that at the end, because it's a somewhat one of the more kind of confusing, nuanced areas. That gets another 19.5. So what does that mean in Ohio? For counties, every county gets an allocation, no matter how large or small they are. It's really just kind of a basic calculation of the percentage of the population that lives in that county. So a total of $2.2 billion. You can go, I have a spreadsheet that we can send around. I don't have time to really pull it up and show you the exact amounts now, but it's all in the Treasury guidance. I'll show you the website at the very end, but that has already been calculated, so we know exactly how much money each county is going to get. Metropolitan cities, the simple definition of one is that it's a city with a population over 50,000. They get money based on a complicated formula, the Community Development Block Grant formula that already exists. It takes a number of different factors that determine how much money they get. Again, those amounts have been calculated. You can see my spreadsheet or the Treasury guidance, but that's another $2.1 billion. Non-entitlement units of government. So this is a somewhat confusing definition. Essentially what the federal government did is they take a state's total population, they subtract out everyone that they know lives in a metropolitan city, so population over 50,000, and then the remainder is a pot of money for non-entitlement units of government. And it's up to the state, based on some criteria that I'm not going to get into because it's somewhat complicated, to determine who those eligible non-entitlement units of government are. Are they towns? Are they townships? Are they small villages? Are they just smaller cities? That is going to be money that flows from the state to those non-entitlement units to use these sources of funding for all the purposes Wendy spoke about, and I'm going to get into in a little bit in a second. So for Ohio, that comes out to about $843 million. There is a catch though. That distribution cannot exceed 75% of that unit of government's total budget. So they're avoiding a problem of flooding very small units of government that have very small budgets with potentially millions of dollars that they don't really have the capacity to spend. So there's that cap, and any amount above that cap for the state will go back to the federal government. So it's potentially the case that Ohio will never actually get that full $843 million. So permitted uses, Wendy already spoke to this, so I'm just going to go over it very briefly. There are 4 big categories: responding to the public health emergency or its negative economic consequences, premium pay to essential workers, government services to make up for revenue losses, and infrastructure investments. So I'm really going to focus on this first bucket. The other ones are going to be spoken about later. But really, the thing I want to emphasize here is don't get too caught up on the details, because the rule is written in a way that is extremely expansive and extremely permissive. Multiple times throughout the rule, they say that this is not an exhaustive list of what these uses are. These are merely examples. I'm not going to read through all of these, but you can see them for yourself. I'm going to highlight a couple of them that I find interesting. One is Public Benefits Navigators. This was a program that was available during the Affordable Care Act to help people navigate new health insurance options. So this slide, I think, is probably the most important of my presentation for these purposes. So responding to the negative economic impacts. When you look through these bullet points, it's really hard to think of human services programs that could not fit into this bucket. Assistance to households, it's really good to see that, because they are contemplating just direct assistance to individuals in the form of rent or mortgage assistance, counseling, legal aid, other just a wide variety of types of services. One at AOF that we talk a lot about is the TANF funded prevention, retention, and contingency emergency benefit that is provided through the counties. That is something that would be well in line with these uses. But again, this is a non-exhaustive list of things that can be funded through this pot of money. Premium pay, we don't need to get into this much, but it's essentially pay increases for essential workers. But I did want to note here that they explicitly call out human services staff as essential workers, social service and human services staff that could get pay increases through this benefit. Revenue losses, I don't want to get into this too much. It's essentially just when there has been a concrete revenue loss for a unit of state or local government, they can backfill that revenue loss with this money in order to ensure that services aren't cut. But Wendy had made this point earlier that there is a maintenance of effort provision requiring states to, not allowing states, I should say, to cut taxes or other sources of revenue in order to backfill it with this revenue loss provision. So it's a somewhat nuanced area. Investments in infrastructure, I'm not going to get into this too much. I know there's a presentation on broadband later. So restrictions on funds, we also spoke about this earlier, can't offset tax revenues, can't shore up pension funds, and can't use it as other restrictions on other federal funding exist as well. So you can't use these federal funds as matching funds for other programs that require matching funds. So the timeline, Wendy mentioned this earlier, but I really want to emphasize this, is that the rule emphasizes kind of taking a slow, thoughtful approach. The payment to local governments will come out in tranches, the first happening more or less now, the second a year later. And the rule contemplates that we don't really know where we're going to be in a year from now. So they're asking states to do a slow, thoughtful approach and revisit whatever their funding decisions are in the future based on changing circumstances. For example, some states might have really critical immediate needs right now. Some states might have a more robust, quicker recovery, which allows them to use some of that money for more long-term projects. So that's all the slides I have right now. I want to give a shout out to Greater Ohio Policy Center. They have some really good resources and have done a lot of thinking and kind of what are some of the best equitable uses of these funds and strategies for how to evaluate funding proposals. But again, just to wrap up, it's the pots of, I want to go really quickly just back to the pots of money here. There's a wide range of sources of funding. And so the money that goes to the state, that goes to metropolitan cities, to counties, and to non-entitlement units of government, these all follow the same rules. It's all the exact same guidance, but it's just a lot of different pots of money flowing to different places at the same time. So I think this is kind of really an exciting time. There's just a lot of kind of variety of uses for these funds, and they're going to be around for a long time. So that's all I have. Thank you for seeing this presentation, and I'm happy to share these slides with a lot of those links to anybody who wants to see them.
All right, Graham, thank you so much. Gina, you are up next.
Let me unmute there. Thanks, Kelsey, for including Ohio in your presentation. I'm Gina Wilt. I'm the Advocacy Director for the Coalition on Homelessness and Housing in Ohio. And this first slide, I don't know if anyone has seen this before, but Marcus and Bill found this and we've been using it. And I just think it's a great illustration. For me, I'm a visual person. I kind of needed to see what was happening to be able to understand everything. So the portion that I'm going to touch on is that orange, to me it looks orange, that orange piece of the pie where it says renters and homeowners, the 40 billion. And you know, the portion that I think Wendy kind of touched on too, and I might touch on a little bit, is that like light green piece of the pie, that 350 billion for state and local aid. So but yes, this is a great slide. Use it, pass it around because I think it's very helpful. So if you want to switch to the next slide, that's fine. You know, this was a gift. This rescue package, this rescue plan was definitely a gift, but it didn't come in a pretty package with the bow. So it kind of came haphazardly, and you know, we received some guidance here, some guidance there. Then we received clarifications on this end and clarifications on that end. So it's been a lot to keep up with, and I'm sure everyone feels the same way. But it is a gift, just not a pretty package. So hopefully all of this information is up to date and accurate. This slide shows the federal allocations. And so I will tell you the Ohio numbers. So your homework will be to write down the Ohio numbers, since I didn't include the Ohio numbers on this slide. So the first piece that I'll talk about is the emergency rental assistance, which I think that's the popular one. That's what everybody hears about. It's what we're most familiar with. So before I talk about the rescue ERA, I'll just give you a quick reminder that emergency rental assistance started with the CARES Act. So we worked with Governor DeWine, lots of people on this call, and it's neat to follow Graham, and I'll be introducing Susan to follow me, because we all worked together to on the CARES Act for that first around 55 million for coronavirus relief there, for emergency rental assistance, and then also another around 55 million for emergency rental assistance through community development block grants, coronavirus, so CDBG CV. And then we had the relief package. So CARES first, then relief. And the relief package, 100 million went through controlling board early on. And then the remaining 465 million was passed through the legislature. The vehicle ended up being House Bill 167, which was Chairman Olslager. And so that was the relief. And then now we're dealing with rescue. So rescue, Ohio will receive 614 million, around there, through DSA to the Community Action Agency. So very similar to how CARES and relief were handled. So around 614 million through development services agencies to the community actions. And then assistance can be provided for up to 18 months. So looking at arrears, looking prospectively, you're eligible if you are at 80% or below AMI, you're at risk of homelessness or have a financial hardship due to COVID. And this assistance, I think, goes until September 2027. And I'll note that we were happy with the new guidelines that recently came out that emphasized and clarified some important items. For instance, Treasury wants to make it as easy as possible to verify income eligibility. And so one way to do this is called self-attestation. And so we just want to get the dollars to the people that need it out the door without people having to wait too long. So that was a great clarification. They also talked about how checks can be cut directly to tenants. So in certain circumstances, like most of the time, the tenant applies, but the landlord gets the check directly, and that will continue. But in maybe a special circumstance that we're not able to work with the landlord, the Treasury did clarify that checks can be cut directly to the tenant. Another important clarification that they made relates to something Tara mentioned at the beginning in her opening remarks, and I'm glad that Tara brought this up, but really relates to supporting our households with the greatest needs. So they made a clarification that there should be priority to households with that are at that 50% or below AMI, area median income. So just a few highlights, and there's lots more information we could talk about, but I will move on to the next portion, which is the Homeless Assistance and Supportive Services Program. So Ohio, out of that federal number that you'll see on the slide, Ohio will receive around 91.9 million, and this is specifically to end homelessness. So really geared towards ending homelessness. And this will go from HUD to the state and to the locals, and that goes, from what I understand, to September 2025. The work will be focused on, again, ending homelessness, housing stability, think domestic violence, human trafficking. You could think about supportive housing for individuals who really need that extra care and attention along with the housing, whether that's a veteran struggling with PTSD or an individual with with an addiction disorder. But what a great opportunity with these dollars to boost our supply of permanent supportive housing. We know we can't end homelessness without supportive housing. That is a key piece to our mission to end homelessness, which I'm always hopeful that we can get there, and that we will get there, but we will always need some sort of permanent supportive housing to get there. And I just think what an incredible and smart investment of one-time funding to provide supportive housing. So look forward to seeing that all come to fruition. The next one I'll mention just briefly is the emergency housing vouchers. Again, this is really focused on people who are experiencing homelessness. HUD did just announce that Ohio will be receiving 1,522 vouchers. So over 1,500 vouchers for the whole state, which I don't know if that didn't sound like that much to me personally, but that's, we'll take it. They've actually announced how many vouchers are going to each of the metros. They will go to the metros directly. I think, and I have, let's see. So Columbus Metro is receiving some vouchers, Cuyahoga Metro, Cincinnati Metro, Lucas Metro, Greater Dayton Premier, Management, Akron, Portage, Stark, Athens, Butler, Lorain. And then there's a handful of smaller counties that are also getting a dozen or so vouchers. So that's good news. Another positive note on this that I thought was interesting when I was looking through it, which was just, I don't know, I thought was really, really cool how they are going to have the metros work really closely with the continuum of care leads. So the homeless continuum of care leads, to put together like a menu of options on supportive services and how they can collaborate, and just make sure that there's robust access to everyone receiving vouchers to what they need to be successful. So I think that looks like it's on a great track. So the last one that I'll mention is the homeowners assistance. So out of that federal pot, Ohio is supposed to get 281 million, and this will go from Treasury to OFA and DSA to help, to relieve people who are dealing with mortgage and homeowner problems. They can, get dollars from that pot there. So there are some smaller dollars to support fair housing activities, which I think is great. There's some smaller dollars in other areas like youth homelessness, which will go through, I think, the Department of Education. but things to look into if you work in those areas for sure. And the last quick mention about that light green pie piece that was in the previous slide, which I don't know if you can go back, but is, the state and local aid. And I just have to mention that, of course, it's a lot of money. People are already starting to call dibs on it. But wouldn't it be great to have this one-time money go towards something that has long-term positive consequences? And of course, we think about one-time money with long-term consequences, affordable and accessible housing development, home repair, neighborhood revitalization, community development, all of those things that go really hand in hand with relief and recovery, just critical to strengthen our neighborhoods as we move into recovery. So, and I know we keep hearing this, but certainly this is an unprecedented opportunity, an unprecedented effort with unprecedented resources, and we no longer have to talk about just moving the needle. We can really start to be bold and start to make significant strides in ending homelessness and really getting us into change the state of poverty that we work with on a day-to-day basis. We don't have to talk about quick fixes. We can be, more surgical and talk about permanent and equitable solutions, and just a great opportunity. Look forward to working with everyone on this call to do that. And thank you. I'll stop there. Probably went too long.
Good morning. My name is Susan Jagers, and I'm with the Ohio Poverty Law Center. So you can go to the next slide. Graham already introduced our organization to you. So we've talked, broadband has come up in a couple of the other presentations already. What we know in Ohio is more than 1 million Ohioans lack access to broadband services. And there's two reasons for that. There's lack of infrastructure. Some people live in areas of the state that just don't have access to broadband. And the other reason is many Ohioans may have access, but they can't afford the service. So, the reality of the digital divide really came into sharp focus during the pandemic. And I think the American Rescue Plan took note of that and talked about that digital divide throughout the interim rules on how the different pots of money can be spent. So these are the 6 provisions I'm going to just touch on briefly and how they can impact Ohio's ability to connect all Ohioans to broadband going forward. So next slide, please. So following Wendy and Graham, they both talked about how the state and local governments can use their recovery funds. So there's some big dollar amounts coming to the state, $5 billion to the state, and then lots of money going to local government jurisdictions. One of the eligible purposes that they highlighted is to make necessary investments in water, sewer, and broadband services. So the interim rule and guidance really encourages the state and local governments to invest in broadband. Projects must be designed to serve unserved or underserved households and businesses. And that is defined in the rule as those who are not currently served by a wireline connection that reliably delivers at least 25 megabytes per second download speed and 3 megabytes per second upload speed. So that's how they define an unserved or underserved area. The rule encourages the state and local governments to prioritize projects that achieve last mile connections to households or businesses. So really to focus on those unserved areas to expand that infrastructure. And I'm really excited that they set the goal to use these money, the dollars to expand infrastructure, that it should be able to deliver services that offer much higher upload and download speeds. So they reference 100 megabytes per second down and up as the target use of this money. So that is really being able to connect Ohioans to broadband that will really work for them to access services, to do telehealth, for kids to learn in school. So all of the things that we saw as challenges during the pandemic. Also note that these state and local dollars can be used for not just infrastructure, but related programs to go to households and to community organizations to provide digital literacy training and other programs that promote access to the internet. So there is some, flexibility in how these funds can be used. Wendy and Graham did mention that the costs for these need to be incurred by December 31st, 2024, but that, the investments in the infrastructure don't need to be completed until December 31st, 2026. So it's really gives us a long time as a state and local governments to plan to address the broadband issue and use those dollars over time to close that digital divide. So there's another fund as well, in addition to the money going through the relief dollars. There's the Capital Projects Fund, and this is an additional $10 billion for capital projects for states to use. The guidance isn't clear on this yet on how they will direct these dollars, but the actual text of the act says that a minimum of 100 million will be appropriated to each state. There's some other designated use of the funds, and then leftover funding will be reserved and allocated based on some different criteria. So Ohio will be getting at least 100 million. The description for these capital funds projects they can be used to expand broadband infrastructure as well. So this really complements the other pots of money going to the state and local fiscal recovery funds. Next slide. Oh, if I could just add that the Treasury will be accepting applications for review in the summer of 2021, and they will issue some guidance before that date for the Capital Projects Fund. So moving on to the Homeowner Assistance Fund, Gina mentioned this fund as a resource for people who are having difficulties or behind on their mortgages. One of the allowable uses of this fund to help people, maintain their home and utilities is payment for utilities, and that specifically includes broadband services. So that's a positive to keep people housed. They can pay for their utilities, including broadband. Next slide. There is also a new program that was set up in this in the American Rescue Plan. It's called the Emergency Connectivity Fund, and this will bring. It has about $7 billion that can go to schools and libraries to expand access to internet and connected devices. The important piece to know about this is that it's going to the Federal Communications Commission to an existing program at the FCC, and that program has been limited to services in schools or in libraries, but the American Rescue Plan allows these additional dollars to actually expand the reach into homes. So this will allow schools and libraries to provide technology that people can then take and use in their homes, like hotspots and other ways to access the internet where they live, not just in the buildings where people go. And then finally, the last pot of money that I just want to mention, if you could go to the next slide, is some additional investments for library services. So Ohio's libraries will be receiving about $4.5 million, and the state libraries can use that to offer greater access to technology and to do digital literacy training and other training for their constituencies. And then I'll just say priority use of funds. Ohio's already investing in some broadband, residential broadband expansion. We think that this is a complement to it, but we really need all hands on deck to expand access to broadband. So we want to make sure these dollars are used in a thoughtful planning process that involves government, quasi-government entities, regional councils, nonprofits, and the private internet service providers. And we also know that the dollars need to be used for affordability as well as infrastructure. We have some programs that are already working to address affordability, and we can use those experiences to help us create permanent internet affordability programs in the future. So I will turn it over to Kelsey for addressing any questions that have come up.
Great, Susan, thank you so much. Big breath. 5 to 7 minutes flies by. I completely understand. So I want to let folks know that our presenters are doing an incredible job of addressing questions in the Q&A as well as in the chat. So we are going to roll right on through, and we are going to invite Will Petrik from Policy Matters Ohio to join us next.
Thanks so much, Kelsey. And welcome to everyone who's joined us today. I'm going to talk more about support for childcare in the American Rescue Plan and also direct support for families. Next slide, please. I think first it's important to note that high quality, affordable childcare imparents parents, particularly moms, to be able to go to work and to be able to go back to work as we recover. High quality childcare is also critical for children to provide them with a strong foundation to thrive in school. Even before COVID-19, thousands of families couldn't afford childcare. Only 41% of kids in Ohio started kindergarten ready to learn. And most childcare workers continue to be paid poverty level wages, and childcare providers are really scraping by on razor thin margins, and many have had to close as a result of the pandemic. These issues are all symptoms of an under-resourced childcare system in the state of Ohio. Since the beginning of the pandemic, nationally, over 2.3 million women have left the workforce, and that's in part due to lack of childcare options. We know specifically that childcare providers are critical for the recovery, for the continued well-being of families and our economy. And without this immediate financial relief, childcare providers will continue to close, they'll continue to accumulate debt, and further reduce the already limited supply of childcare options. So that's why the American Rescue Plan is so important, particularly for parents and childcare providers. So there's two major pots of resources for childcare. One is there's $800 million, this is specifically for Ohio, to help stabilize childcare providers. There's also $499 million in the Child Care Development Block Grant, and the intent of that is to expand childcare assistance. Next slide, please. In terms of the stabilization fund, the overall purpose of that really is, again, stabilize the childcare sector. So these funds can help childcare providers pay for COVID-related expenses, anything from personnel costs to increasing the wages of the workforce, rent and utilities to cover personal protective equipment for staff. Could also go toward goods and services for those providers who have not been able to provide care during COVID, to help them resume providing care. And in terms of the federal guidance that actually came out earlier this week, it says that states can use up to 10% of these funds for administrative activities. So that includes items like publicizing outreach to ensure that providers know how to apply for these stabilization grants. The state can also use administrative funds to provide technical assistance to providers to help them apply for grants. The guidance does say that lead agencies, and that will be the Ohio Department of Job and Family Services, must spend 90% of child care stabilization funds to qualified child care providers to really, again, support the stability of the child care sector. And as we think about our ideal uses of funds in terms of bringing back and building the supply of childcare I think particularly we're interested in building the supply of non-standard hour care. So care for folks that are working low-wage jobs who work maybe second and third shift. Many of those workers really struggle to access childcare that meets their work hours. We also want to build the supply of infant and toddler care and childcare in underserved areas. So again, you know, as we think about how to prioritize this $800 million, we hope the state of Ohio targets these stabilization resources to Black and brown childcare providers, to family childcare providers, and providers that most need support as we recover. Next slide, please. So the timeline for this, I know, Wendy and Graham talked about a longer term time frame for the state and local dollars. The American Rescue Plan really wants to get these dollars into the community to help stabilize the childcare sector. So the guidance has that the stabilization funds for childcare providers must be obligated by the end of the federal fiscal year 2022, that's September 30th, and all stabilization funds must be liquidated by the following year. Next slide. So there's also close to $500 million for expanded childcare assistance. The federal guidance hasn't come out on these dollars, but these are childcare and development block grant funds, and they can be used to expand access to childcare to more working families. They can make childcare more affordable, make wages more competitive for the childcare workforce. It could be used to improve quality of childcare or enhance childcare provider rates. And in terms of our priorities, we've been talking during the state budget about the need to make childcare more affordable and more accessible for more families. So, we hope that the state uses these funds to expand initial eligibility for publicly funded childcare to make sure more working families have access to basic, affordable, and high quality childcare. Next slide. In terms of the timeline for the expanded childcare assistance dollars, this is a little bit longer of a time frame than the childcare stability funds. So all childcare assistance funds must be obligated by the end of the federal fiscal year 23. And must be liquidated by September 30th, 2024. Next slide. I also wanted to just talk briefly about just the immediate support for families, because part of Advocates for Ohio's Future, we care about kids and families who are vulnerable, and how do we make sure they have their basic needs met? So it's food, housing, childcare, healthcare. So the American Rescue Plan does provide unprecedented short-term resources for families. Again, I don't have time to get into the deep details of all of this, but again, it provides immediate support, both through expanded tax credits for working families and also through these stimulus payments. So there's $1,400 stimulus payments for adults, and then $3,000 per child for the child tax credits. That's for kids age 6 to 17, and $3,600 per child for kids under age 6. There's also a child independent care tax credit that's expanded. Both the child tax credit and the child independent care tax credit are also made refundable in the American Rescue Plan. So it's more families have access to those resources. I'm seeing I'm at 7 minutes. So if you can go to the next slide, I'll try to wrap up quickly. The way that I like to think about it is an actual family. So say Mary and John have 2 kids, ages 4 and 7. Together they make $100,000, and they plan to spend $4,000 for summer camp for their 7-year-old and $5,000 for childcare for their 4-year-old this year. So what would they be eligible for? They'd be eligible for $5,600 in that one-time stimulus payment. That's for each parent and then their dependents. They'd be eligible for up to $6,600 in a child tax credit payment. $550 per month will, they could start seeing monthly checks in July of this year, and the other half when they file their tax return for next year. And similarly for the child independent tax credit, they'll want to keep track of their expenses this year, file their taxes early next year, and they'd be eligible for $4,500 in a tax credit. So again, these are one-time resources. The American Families Plan extends these. So we are really pushing for the American Families Plan to extend and make these tax credits permanent. And I've gone over my time, so I'm going to pass it to the next speaker.
Thank you, Will. Hi, this is Joree Novotny with the Ohio Association of Foodbanks. I'm just going to talk to you today about the elements of the American Rescue Plan Act related to food security. Next slide. So President Biden emphasized the importance of addressing the hunger crisis that's been taking place across the nation over the past year in remarks his second day in office. And we saw some action by executive order prior to the American Rescue Plan Act that I wanted to mention briefly. Next slide. So by executive order or through administrative authority, I just want to make sure everyone knows that the administration did begin seeking approval from DOJ to expand SNAP emergency allotments that were previously authorized by Congress to reach households with little to no net income. During the remainder of the emergency declaration, they did index pandemic EBT benefits for children out of school time to the increased value of the SNAP benefit, the 15% boost. So basically families are getting a little bit more because of that action. They initiated a process for revising the Thrifty Food Plan, which is used to calculate SNAP benefits to better reflect what it costs to provide your family a healthy basic diet. They also extended many waivers, including some related to access to take-home summer meals for all children. So then we'll get into what was actually included in the American Rescue Plan Act itself. This act did extend the 15% boost to the maximum SNAP household benefit, which was authorized initially for a shorter window by Congress in late 2020, and they extended that through September 2021. That means about an average of $28 per person per month in Ohio, or about $122 million additional for Ohio for 3 months. We think that that's really valuable, of course. It's being spent in local communities. SNAP is really effective in times of recession because customers go to their local retailers to buy the food that their families need, and then those local retailers and local economies benefit from the tax revenue that that generates. The ARPA also extended pandemic EBT for this summer and throughout the duration of the public health emergency. Ohio will need to seek plan approval for students, but Ohio has been really a leader on pandemic EBT. We have no doubt that they will do so, and that will provide eligible for students eligible for free and reduced price meals, as well as non-student children under 6 in SNAP households to get summer EBT. That should be over $370 million estimated this summer for families with children to spend on the food they need. It's going to, if Ohio uses the standard federal benefit, it will be about $375 per kid who's eligible. So that would include about 846,000 school-aged Ohio children and an additional 142,000 children under 6 in SNAP. Next slide. Also included in the American Rescue Plan Act were SNAP administrative funds, over $1.1 billion total across the country in 100% federal funding to support state agencies who are responding to increased demand for SNAP. Ohio's share over 3 years is nearly $35 million, including $7.5 million in this fiscal year. Just at the end of last month, SNS did release guidance related to this administrative funding, and we have just introduced a sign-on letter. We're encouraging anyone who works with SNAP customers assisters in the community who connect people with public benefit programs, who may recognize that there are some challenges and weaknesses related to the state's current portal for applying for those benefits. We'd really like to see these SNAP administrative funds focused on modernizing and optimizing the current system that we have to better serve families and households seeking that assistance and also seeking to maintain that assistance. I'm going to drop the link to that sign-on letter in the chat for everyone, and I'm sure you'll also see it pop up in other places. Just encourage you to consider adding your weight to that recommendation. We'd really like to see it focus on some of the elements included in the federal guidance, such as mobile optimization for Ohio benefits, text-based and SMS messaging related to cases, the ability for SNAP households to upload their documentation through a mobile app, just a lot of ways to make that program more accessible for the households across Ohio that rely on it. Next slide. And then finally, I want to make a note of an additional nutrition package included in the American Rescue Plan Act related to WIC. So there's two pieces here, the Women, Infants, and Children program. First, important to know and very timely, it authorized $490 million at a national level more for fruits and vegetables in the WIC benefit. And this was authorized in a way that allowed states to choose a 4-month window through any time between the passage through September of this year. Ohio elected to go with a period of April through July. Please encourage any clients you know who do participate in WIC or could participate in WIC to seek it out now, because there is an additional boost to what they would receive in their fruits and vegetables benefit. And the time to act is right now. Additionally, it also included $390 million for WIC modernization, innovation, and outreach. There is no guidance yet on that, so we'll look for that, but there's lots of opportunity for modernizing WIC. Just as an example, Ohio WIC customers have to physically go to their WIC office to load benefits onto their cards, so we look forward to modernizing that program for moms and kids. And just in closing, you can go to the next slide. I just want to mention that half of the people that our food banks serve through our network across the state earn slightly too much to qualify for SNAP. So as others mentioned, we'd really like to see other pools of funding spent on those families and seniors, people living with disabilities whose incomes are slightly higher, making them ineligible for SNAP, but still making them food insecure. And I will turn it back to Kelsey.
Joree, thank you so much for your presentation. And it is such an honor to be included among my leaders this morning. My name is Kelsey Bergfeld. I'm the Director of Advocates for Ohio's Future. And once again, thank you so much for joining us. I'm going to talk about the Pandemic Emergency Assistance Funds included in the American Rescue Plan. So these are dollars targeted towards TANF eligible families, really those most vulnerable low-income families that can use probably the biggest hand, especially during these times. And what the American Rescue Plan Act did, it established a $1 billion Pandemic Emergency Assistance Fund. So 1 billion with a B, so that is a great amount of money heading to the states to, again, target those families for immediate needs and also to help stabilize a lot of those families and communities. So Ohio received just under $34 million from these funds. So it is a good amount of money, and it's going to do great work throughout our counties. So these dollars must be expended, they must be spent between April of this year and all the way through September of next year. So there is a time frame attached to them, but I have a feeling they're going to go quick. So a couple uses for these dollars. Again, these dollars are really intended for this specific crisis situation. So responding to the pandemic, they cannot be meeting kind of ongoing needs. Again, kind of one-time emergency assistance. And some of the things that they have ideas for what you can use these dollars for. Again, emergency assistance and diversion payments. In Ohio, we call these PRC, or Prevention, Retention, and Contingency dollars. It's a program that is administered by the counties to, again, kind of really help those families on the brink with one-time expenses. Emergency housing and short-term homelessness assistance, emergency food assistance, short-term utilities payments, burial assistance, clothing allowances, as well as back to school payments. So the American Rescue Plan Act was also very clear on what these dollars could not be used for. So very kind of stringent categories here. Want to make sure that these funds cannot be used for things like tax credits, childcare, transportation, kind of short-term education or training, and really, again, want to enforce that these are one-time dollars. So Ohio has already made their decisions about what they're going to use these dollars for. So just last week, Ohio decided that all these funds are going to be provided to county agencies to support the PRC program. It's such a mouthful, but Prevention, Retention, and Contingency Program. This is a program that I know AOF and a lot of our partners here on the call have been interested in, to make sure that we strengthen and can strengthen this program through the legislature, and make sure that we know that our elected officials know about this program, know about the good it does, and about its potential to do even more good in the future. So right now, what's really great about this kind of funding stream is that there is already a kind of formula allocation within the Ohio Administrative Code. So each county gets their dollar allocation of that $34 million chunk, and to distribute to families and communities as they see fit. So counties have PRC programs and plans that they have to put in place. I think every 2 years they have to revisit them and show how they plan to use these dollars and get them out to members of the community to, again, assist with those one-time needs. So right now, again, the $34 million was amended into a bill just last week in a Senate Bill 109. This is another big bill that was actually allocating a remainder of Consolidated Appropriations Act dollars, moving through the General Assembly. So it was amended into the bill and passed out of the House and Senate in the same day. So once again, things that we imagine these PRC dollars to be used for, if a car breaks down, maybe a family could just need a little boost to help repair that tire, get a new tire, so make sure that family can go to work. Again, things like immediate housing assistance, as well as utility bills. So we look forward to working with the Department of Job and Family Services to make sure that we are tracking where those dollars go and what uses they are being used for, as well as making sure that we see the outcomes and help those families, again, stabilize so they can move on from this pandemic successfully and in the best way they can. And with that being said, I think we do have we might have a few open questions. I know our panelists are doing great at addressing a few within the Q&A and within the chat box. But with that being said, we are going to go ahead and move on right away to our next presenter, who I believe is Loren Anthes.
Thank you, Kelsey. Hello, everyone. Thank you for inviting me here today. I think just waiting on my slides there. Excellent. So I'm going to talk a little bit about Medicaid. A number of these topics are going to come up again through the presentation with some of our other panelists who may have more detail, more direct program expertise. So what I'm going to cover is going to be some high-level sort of thinking and policy concepts that were represented in the American Rescue Plan Act. Next slide, please. If you need to get a hold of me, you can find my email there. You can also find me on Twitter at Loren Anthes or Community Solutions at Community Sols. If you haven't already, you can always find us at www.communitysolutions.com, where we write on a number of these topics. But stay tuned for more research and information coming out. Next slide, please. So today I'm going to cover on three areas of policy development with the Rescue Plan Act: coverage, benefits, and finance. One thing I'd like to highlight: when you see that little logo, the little blue circle, that indicates that we may have something available on our website that goes into more detail regarding the particular topic that is addressed. All you have to do is go to communitysolutions.com and look for it in our Sherlock, and you can find it pretty easily. Next slide, please. Okay, so this is how I'm going to organize most of what I'm going to present here. one being the policy concepts, and then two, where there may be impact in Ohio. So a couple of things here when it comes to the Rescue Act. First of all, the Biden administration has a direct interest in maintaining and supporting the Affordable Care Act. I believe the president used 3 other letters when describing it when it was initially passed. So obviously some of those policies are there to support that work and support that policy effort. And first is the Medicaid expansion incentive. So for states that have not yet expanded their Medicaid programs, of which I believe there are still 12, there's a 5% federal medical assistance percentage bump for those non-expansion states. So additionally, what that means is there will be additional federal funds for states that have not expanded Medicaid. Ohio is not in that category, obviously. There's also a provision, and this is something that is certainly of concern to us here in Ohio, is around postpartum coverage. So starting April 1st, there's 5 years of availability to extend postpartum coverage to a full year beyond the current standard of 60 days. So when a woman who's enrolled in the Medicaid program delivers, currently in Ohio, all we have in our state plan is 60 days of coverage. This would extend that to a full year. And I know that there are a number of advocates on this call who have highlighted this for the legislature. So first of all, that 60-day coverage is currently in law. In order for it to go to a full year, a change is required, and it may require an appropriation. A number of years ago, the General Assembly essentially said for any optional groups identified by the federal government that the state or the executive must request that coverage group is enabled through the Ohio Revised Code. So there would need to be a law change and potentially an appropriation. Once that is done, the state could submit a state plan amendment. Some states have done this through 1115 demonstration waivers. I don't think that's necessary in this case, although technically speaking, Ohio does have an 1115 demonstration waiver for individuals with substance use disorders, where they are planning on extending this coverage to this group. The reason that hasn't been activated yet is because of the way the public health emergency has essentially suspended normal eligibility rules. We basically have postpartum coverage in our state currently. According to some Legislative Service Commission analysis, which was inclusive of the SUD population, we're looking at about 14,000 women in the state of Ohio who would benefit from this coverage annually. If we look at some of the numbers behind what that coverage could mean, it's roughly around 15 million for fiscal year 22 and around 31 million for fiscal year 23. And the reason for that difference mainly has to do with ramp up. It takes time to submit a state plan amendment, so on and so forth. So we are hopeful that something will happen in the legislature. I'd be happy to answer or whatever questions individuals may have. A number of states have already pursued this. It's a pretty attractive option because it is directly related or correlated with better outcomes in maternal and infant health. Next slide, please. All right, some benefits here. So there's a number of things that were outlined in the context of the legislation, some of which are directly relevant and may be familiar, some of which may not and need to be worked out. So first of all, vaccines are 100% covered. So if you're on the Medicaid program, you go get your shot, you don't have to worry about any cost sharing. Some other pieces in there include dollars for mobile crisis. So we have some mobile crisis here in the state of Ohio, but there's an option to increase match to 85%. So, basically additional federal dollars for the first 3 years, and then some potential availability for additional monies for 5. There's also $15 million grants that are available for any states that may be interested in this. There's also a 10% increase in federal match for home and community-based services. I know my friend Jordan is going to be talking about that, so I'll leave that be. And then there's $900 million for nursing facilities to address quality personal protective equipment, including $250 million for nursing facility strike teams to address COVID-19 related issues. Certainly something that's needed. Some of these congregate care settings, particularly in long-term care, this is where some of the most vulnerable folks are in regards to the virus. There's also $80 million for pediatric mental health services and $3.5 billion in block grants for the behavioral health workforce. I'm sure Soley will touch on some of that. So Ohio impact. What is Ohio considering? Not sure. We don't know. They're sort of saying it's under review. though according to my estimates around HCBS, using historic data, the 10% increase would be over $500 million to the state. Next slide, please. All right, the last thing, finance, rebate cap on drugs. So for those of you who may know, when we have drugs in our states, states directly receive rebates. This cap was eliminated. It could be worth significant dollars to the state over a certain amount of time. I looked at some of the data, and just in 2019, 134 million in rebates came to the state. If you applied that same sort of logic with the elimination of the rebate cap based off of some national data, we're talking over $300 million over 10 years. There are also a tremendous amount of resources made available for rural providers in particular, which is why I included that map, because Medicaid disproportionately serves rural communities. And like I said, the cap elimination of 304 is a significant sum to the state. All right, so that covers it for me. If you have any questions, you know where to find me, and you can follow us on our website, and happy to follow up on any of these topics, but I will now turn it over to Soley, who will talk about some of the behavioral health provisions. Thank you.
Thanks, Loren. I'm Soley Hernandez with the Ohio Council of Behavioral Health and Family Services Providers. So I will go ahead and do just a brief overview of some of the American Rescue Plan Act provisions that impact behavioral health. So this is just a general overview of us and what we do. So we'll go right past that because we're coming up against time here. So I'm going to try to be fast. The National Council for Mental Wellbeing, which is formerly known as the National Council for Behavioral Health, actually provided a really nice overview of the funds for behavioral health organizations. And so that is linked in the PowerPoint presentation. SAMHSA will be getting additional funding to the tune of, excuse me, $3 billion for the Substance Abuse Prevention and Treatment Block Grant and the Mental Health Services Block Grant. So each one will get $1.5 billion. These funds get allocated to the Department of Mental Health and Addiction Services providers, and then are dispersed among the county ADAM boards and providers. Next slide, please. Additionally, there is funding for Certified Community Behavioral Health Clinics, or CCBHCs. This is an integrated care model that SAMHSA and the National Council have been supporting for the past several years. An additional $420 million is going to SAMHSA to fund these expansion grants. And actually, Ohio providers, we have 11 CCBHC expansion sites in Ohio currently, and 9 of them were actually awarded from funding from the CARES Act. So the CARES Act had $250 million earmarked for CCBHCs. So we do anticipate additional Ohio providers will receive CCBHC grants from the American Rescue Plan funding, but we don't have that information available yet, but we're hopeful to see at least a couple more CCBHCs in Ohio, and we've been working with the Department of Mental Health and Medicaid on how to sustain that as a state. So next slide, please. So provider relief funds, these have been touched on by a couple of other folks, but $8.5 billion in new provider relief funding is available for rural areas specifically, and behavioral health organizations have been able to apply and benefit for these funds just depending on the specific criteria that the Department of Health and Human Services has set. So there have been several rounds of these funds available for various provider types, and we've been encouraging behavioral health providers in Ohio to ensure that they tap into those funds when they're available and appropriate for them. Next slide, please. And then there is just funding, just mental health and substance use disorder funding generally available through SAMHSA for a variety of funds for addiction services, mental health treatment, workforce education and training, suicide prevention, and then public education campaigns. And you've seen some of that in Ohio, you know, with the Caroline and efforts like that. Next slide, please. So guidance, I think this is the general guidance for state and local governments, because behavioral health providers also work with their local municipalities and governments to provide services that are beneficial. So that flexibility in those funds can be used to meet local needs for behavioral health services as well, if that is something that the local government deems necessary. I'm not going to dig into this stuff because a couple of our other presenters have done so, but there are links in here if you are interested in that information. So I'll go ahead and go to the next slide, please. So generally the thing, that we were very pleased with is that it is clear that behavioral health was indicated as an essential service and an essential public health response. So funds from the American Rescue Plan can specifically be used for behavioral health treatment, and those specific interventions are listed there. And then the other piece is providing premium pay to essential workers, which does include the behavioral health workforce. Next slide, please. So in terms of guidance, actually, ironically, the Department of Mental Health within the last month or so just got guidance from SAMHSA on the December package that was released. So there isn't guidance yet on the mental health and SAPT block grant funds from SAMHSA to Ohio MOS on the ARP funding. And the same with the provider relief funds. So the Department of Health and Human Services has not yet announced guidance for these new allocations. They actually haven't released guidance from the last package allocation either. So we're still waiting to see kind of how those funds will be used and who they'll be prioritized for, what eligibility will be. Timelines, just generally, the state and local funds, this has been touched on, but can be expended through December 31st of 2024. So if behavioral health providers are working with their local governments to provide services, that would be the timeline that they would look at. But for the mental health SAPT block grant, CCBHC, and then those other funds we touched on that would be coming from SAMHSA, the American Rescue Plan Act just says they are available until they are expended. So they did not give a specific deadline. Next slide, please. So for behavioral health, for ideal uses for behavioral health, how we would like to see these funds be best used for treatment and for Ohioans is really to help establish the crisis continuum. The state has been doing a lot of work on mobile response and stabilization services, crisis call centers, and the 988 implementation, which is set to go live nationwide in July of next year. I touched on the CCBHCs. This is really a model of integrated care that is best for people with severe mental illness and substance use disorders, and really is kind of what we're seeing as the model of care and service delivery for the future of behavioral health. So we're certainly hopeful we'll see more grants in Ohio. And then we are always an advocate for direct funding to the behavioral health organizations. They know how to use the money and how to get services created and how to touch on workforce, what their COVID response has been, the implementation of telehealth, being able to just outreach to people in need. So there are a couple different ways that the American Rescue Plan Act allows folks to use funds that providers can use specifically. And next slide, please. I think that's it. So I am right up at my time, but my contact information is here, and I will check out the chat if you have any questions, but I will now turn it over to Jordan Ballinger. So thank you.
Good morning, everyone. I just want to say thank you to Advocates for Ohio's Future for having us here again to present on home and community-based services. My name is Jordan. I'm the Policy Director for Disability Rights Ohio. We are the P&A, the Protection Advocacy System for the state of Ohio, and I'm also representing the Ohio HCBS Coalition. As we move forward, I'm going to say HCBS a lot, so just so everyone's aware, HCBS stands for Home and Community-Based Services and Supports. Move on to the next slide. So this is just a graph from the Department of Medicaid that they put out in 2019. This shows the shift in individual enrollment in long-term services and supports who are receiving services in long-term care facilities compared to home and community-based settings. In 2007, 54%, so the majority of individuals were in long-term care facilities, 46 were in their home and communities. As of an estimate for 2021, that has shifted to 68% receiving services in their home and communities compared to 32% in long-term care facilities. However, even though there's been a huge shift in individuals who are receiving services in the community, the funding has not necessarily kept up with this shift over the past decade. This has also been exacerbated by the pandemic, as long-term care has had the hardest impact from the pandemic, accounting for over 48% of all COVID-related deaths. So now more than ever, it's incredibly needed for there to be investments into HCBS. Next slide, please. So luckily, Congress passed the American Rescue Plan, which did increase the FMAP by 10%. So this will allow states to put more money into HCBS. States are able to implement or supplement the implementation of one or more activities to enhance, expand, and strengthen. However, states cannot use this funding to supplant any of existing state funds. So they have to use it to supplement and expand. They're able, the increased FMAP goes through March 31st, 2022. However, states can use the increased funding through March 31st, 2024. I have estimated here, Ohio will be receiving over $434 million in their increased FMAP. I know Loren mentioned over $500 million. This estimate comes from Kaiser Family Foundation. However, Kaiser has a pretty low estimate, so hopefully we'll actually be seeing a lot more than the $434 million, which will be good news for HCBS. You can move on to the next slide. Part of the increased FMAP, there's some categories of qualifying spending that trigger the increase. This includes home health care, personal care services, self-directed personal care services, program of all-inclusive care for elderly, PACE, rehabilitation services, and private duty nursing. So all of those things kind of trigger this increased FMAP. Currently, Ohio does not have a plan for their HCBS spending. This is simply because CMS did not come out with guidance until last night. So CMS released their guidance last night. As I was putting together this presentation, a lot of what you'll see after this slide, I've tried really hard to pull as much from the guidance as possible, but I have not, unfortunately, been able to review the guidance in depth because it's been less than 24 hours. So us in the coalition and our partners are really looking forward to seeing what Ohio has in store, because there is a lot of potential with this funding. The HCBS Coalition has been advocating specifically for increased rates for providers, wages for direct care workers, increased access to care coordination, transitions out of long-term care facilities, pandemic relief payments to providers, and expanded provider capacity in the historically underfunded HCBS system. You can go to the next slide. So these are kind of the COVID-related home and community-based services needs that the coalition is really looking for the Department of Medicaid to use this additional funding to support. So for instance, provide new or additional waivers to reduce the risk of institutionalization, increase rates for home health agencies, increase wages for direct care workers, payments to providers for hazard pay, overtime pay, and PPE costs incurred during the pandemic, increase services for individuals transitioning out of institutions and into the community, increase funding for case management services for those most at risk of institutionalization, increase funding for transition coordination services, and increase rates for behavioral health providers for mental health services and supports. Next slide, please. And then as a coalition, and even it's contemplated in the CMS guidance, there is an ability to use this funding for long-term capacity building. So although there is parts of this that are meant to really address the issues that were exacerbated by the pandemic, there is also contemplation that this money should be used by states to build out a system that has not been appropriately funded and does not effectively support people with disabilities and older adults to stay in their homes and communities. So part of that is providing new or additional HCBS services, expediting eligibility processes for access to HCBS, increasing waiver slots to reduce the number of individuals waiting to receive an HCBS waiver, expanding community transitions, and expanding provider capacity by increasing provider rates and increasing wages for direct care workers who are providing services to people with disabilities and older adults in their communities. Okay, I ran through that, but that is all I have today for the HCBS Coalition. So if there are any questions, happy to answer them in the chat box. And I will turn it over to Beth from the area agencies on aging.
All right, great. Thanks, Jordan. And that was a great presentation on HCBS. We are certainly interested in that area as well. My name is Beth Kowalczyk. I'm the Chief Policy Officer for the Ohio Association of Area Agencies on Aging, and I'll be talking about ARPA and older adults. So next slide, please. I just wanted to summarize that the main vehicle for COVID relief has been through the Older Americans Act, and there are a couple sections in that act that are focused on specific things that serve older adults. That would include congregate meals, which are typically provided in places like senior centers, home delivered meals, supportive services, which is a broad range of categories that and services that can serve older adults, and then family caregiver support. And as you can see, there has been quite a bit that has been provided through the Older Americans Act. And these dollars are primarily provided to area agencies on aging to then assess the needs in their communities and provide the services based on these different sections. Next slide, please. And just I wanted to plug the COVID-19 report. This kind of outlines through those dollars how the area agencies have spent the money. This was a point in time from March to July 2020, but the work continues and have had to pivot to obviously couldn't provide services at senior centers, provide meals. So shifting to grab and go meals, carry out meals, partnering with restaurant programs, expanding home delivered meals, and engaging in more online engagement and assisting older adults with obtaining the technology to do that, as well as making sure that people stayed connected through telephone reassurance programs and other kinds of programs. You can check that report out online on our website. Next slide, please. So the American Rescue Plan, again, has provided additional significant dollars through the Older Americans Act, and these are the dollars that are allocated to Ohio. As you can see, we have been fortunate to receive funding in all of these areas of the Older Americans Act, additional support for meals and supportive services. Prevention and wellness is evidence-based health promotion and disease prevention programs that like falls prevention, managing chronic diseases, and programs to detect and reduce depression among older Americans. And funding for the National Family Caregiver Program. These funds also come to the area agencies on aging to assist family and informal caregivers to provide in-home supports, including counseling, respite care, training, and more. What's, I think, most important with the ARPA funding, unlike the previous COVID relief dollars, ARPA allows the AAAs to spend the dollars under the traditional Older Americans Act programming and services and not limited to COVID relief, and that it's to remain available until expended. And so there's more flexibility to meet the needs of older adults in this program. Another thing I want to point out is it seems like there's a lot of dollars coming to Ohio through these COVID relief programs and ARPA, but really we have seen, as many of you know, older adults in Ohio, our state is aging, there's more of us, our population is growing, and yet the resources have not kept up to meet the need. And so it's really important to note that these are one-time dollars. They will fill a need, but the need's going to remain after these dollars are expended. And so, you know, working with Jordan and others, advocating for both in the Medicaid space and outside of Medicaid for continuing to increase the capacity for home and community-based services. Next slide, please. One thing I wanted to point out on the American Rescue Plan in Title 3B, which is the supportive services section, the act actually calls out vaccination outreach and social isolation programming, including investments in technology. These are not traditional areas, and traditionally Older Americans Act dollars in supportive services, you contract with service providers to provide direct services. This gives a little more flexibility for area agencies on aging to engage in activities to support older adults in terms of these areas. Next slide, please. So one other thing to point out with all of these dollars, because Ohio is under a national disaster declaration, it triggers a section of the Older Americans Act, which permits the states to use these dollars. As you could see, there were silos. The disaster declaration triggers this provision where the funding can be used in any of the silos to support disaster relief. So it provides broad flexibility for states to use funding maybe from one silo to provide services in another without having to go through a lot of bureaucratic hoops, particularly in this situation with disaster relief, so that they can respond quickly. And this would apply to both the existing Older Americans Act funds that we are traditionally allocated, plus these disaster dollars and ARPA dollars. Okay, and I'm going to skip through because Jordan covered EFMAP. So next slide. One more. Okay, other programs, this is my last slide. Ohio is receiving $10 million to support the long-term care ombudsman program. And this program actually provides support for people receiving home care, assisted living, and nursing home care. They act as advocates. They resolve complaints about services and offer information about benefits and consumer rights. Very important program. Other things I noted about the American Rescue Plan, we don't have a direct interaction with these programs, are the Commodity Supplemental Food Program, which is a monthly food box program for older adults. Nationally, there's $37 million. It looks like, and I've had some conversations with Joree in the chat, that Ohio is not going to benefit from these additional dollars. We do have a pretty large program, and so the money's being spent to help states who do not have a program or who have fewer slots and serving fewer people. Elder Justice Act, $276 million. Is the national figure. I don't know what Ohio is going to get, but this will go towards supporting adult protective services and other elder justice initiatives. And then finally, there is funding specifically for Section 5310 transportation grants to improve transportation access for older adults and people with disabilities. And I believe that is all that I had. And I will turn it over to Darold.
Thank you, Beth, for that. I'll be talking about education today and what we got from the America Rescue Plan. Ohio's been fortunate to receive funding from the Family First and from the Coronavirus Acts. So, in the emergency elementary secondary school relief acts, we had like 3 different versions, and the first 2 we got like $2 billion, and then in version 3 we're going to get $4.45 billion. And while there's a lot of similarities between how the different URSA monies can be used, the one difference, or some of the differences between 2 and 3, are as follows. The 20% of the money has to be set aside in URSA 3 for learning loss. But just like the other acts, you could use this money for building repairs, ventilation, cooling, spacing. You could use it to cover costs related to COVID. You could hire staff or make staff whole who are laid off during this process. This helps bus drivers and food service staff who might have been laid off during this process. Also in the rescue plan, we have monies for after school programs and summer learning. One of the things that they have to do is look at evidence-based models of improving learning and making up for learning loss. There's targeted assistance to serve students who are underserved, and wraparound funding, services for wraparound programs, so that we can address the social, emotional, academic, and mental health needs of the students that are greatly enhanced by the pandemic. We see that there's state can keep 10% of this money. And we also see that in the slide here, there's money there for the homeless provision. The McKinney-Vento Act is the homeless piece right there. Perkins is the Career Tech Center piece, and additional funds for students with special possibilities with his IDEA. So in adult education and literacy. So we have those programs that help close the gap here and for that fund. And the next one, next slide. I think here, yeah. And so one of the things that we were making sure is that when you're doing this repair facilities and upgrading facilities, there's a lot of school buildings in Ohio. While we do have a school facility fund, there are a lot of school buildings in urban centers and in rural communities that have not been able to pass those bonds. And because they haven't been able to pass those bonds, they still have big financial needs for air conditioning, filtering, purification, addressing heating, cooling systems and doors. So there's a lot of things that this money could do to help close those gaps for those school districts. Basically, we have 3 years to use the money. So we're looking at 2023 to look at that, 2024. So we have time to use this money and really build a new school system. The one thing that is new to this ESSER 3 money is that school districts should include, it speaks more concretely to this. It says school districts should consult with the community as it develops its plans for the future. And when it talks about the community and plans for the future, they're talking about foster care, incarcerated youth, migrant students, faith-based communities, teachers, students, parents, all should be involved in developing the plans for how to use these funds. And that's going to be important. While we're operating under a pandemic and a lot of trauma for teachers and students and parents, we need to make sure that we use this money in a wise and efficient way to address some of the learning gaps that we have. And with that, I'll shift it to Rebecca.
Thank you. I'm actually going to just go ahead and stay on this to get us all wrapped up quickly. So as those before me have noted, ARPA focuses on rescue and stabilization. And I just want to be clear that from a workforce perspective, it's critical that these basic needs, safe workplaces, and what individuals have to be equipped with is addressed before we really push a strong return to work. And so as we think about what needs to happen, it definitely support my colleagues here in the work that they're doing. As is typical with workforce, there are threads of workforce activities or allowances throughout ARPA, and most of them are directly tied to the priority areas that you've heard everyone else talking about. Example would be, as Kelsey mentioned, the PRC investments being used for supportive services to get folks back to work, or even ARPA funds to train community health workers to help with vaccinations or promoting vaccinations. There is $3 million allocated to the EDA, and some federal advocates are pushing for some of that to be allocated to sector strategies in local areas. That's the Economic Development Administration. Those would be competitive grants nationally, so there's not a specific allocation for Ohio, but could be a possibility of some work there. What's particularly, I think, interesting about this is that the Treasury guidance is also very specific, that they're going to ask for the workforce plans of the infrastructure projects. So water, sewer, broadband, which are funded in large part through the local area investments. They will be looking for how they are connecting to workforce. In an ideal world, as we're deploying ARPA funds, Ohio, because workforce crosses all of these areas, would really be focused on targeting the safety, quality, and really access to jobs that we are bringing back with these funds. We don't want to put people into jobs that are not going to support them and be ultimately good jobs. And then as a state, we would like to see some stronger data systems that focuses on a cross-system approach to mitigating the racial disparities we see. And really, unemployment may be going down, but we have to ask for who and deal with what we see. So from a workforce perspective, you're going to hear a lot more out of the American Jobs Plan and the American Families Plan. And with that, I will pass it over to Steve.
Rebecca, thank you so much. So Steve had to hop off a little bit early today. We are a few minutes over, and I just want to thank all of our presenters today. What an incredible lineup. What just a great resource we have here at Advocates for Ohio's Future for everyone to dig in to their respective issue areas and pull out some really great information for us today. Cannot thank my friends enough. So I also want to remind folks that we'll have our slides posted at www.advocatesforohio.org/webinars. So those are actually already up if you would like to do a quick review before lunch. Maybe, get the appetite going would be good. And we'll also be following up with an email with the recording of our webinar, as well as the slides and any additional information from our presenters later this afternoon. So we want to thank you again for joining us. And one more time, that website, advocatesforohio.org/webinars, so plural. Want to thank you again for always tuning in to our webinar series. We'll be back in 2 weeks with another review on the budget and keep you updated as we come into the final months and final weeks of the state budget process, as well as kind of intermixing these federal dollars into the process. It's been a fun ride. So again, thank you so much to our presenters. We appreciate you as our viewers, and we're here as a resource. Have a beautiful weekend. We'll talk to you soon. Bye, everyone.